Hello, everyone. I am Melissa Budzinski, and I'm from Gilda's Club, Grand Rapids. And we're so grateful that you're joining us here in this recorded session about multiple myeloma. We are so grateful to be able to bring you this program and this information about this very important cancer and how to manage it when you're newly diagnosed or someone in your life has been newly diagnosed. If you have questions for us, you are welcome to send those to us either by email through our website, gildasclubgr.org, or to call us on the phone, 453-8300. You may also post some questions in this Facebook posting area, and we will get to those. We're not going to be able to read those right away, but we will get to those as soon as possible and get back to you with those questions. So today we're so grateful to have with us Jenna Curtis. She's an RN at Spectrum Health in the adult blood and marrow transplant unit. And we're just really grateful, Jenna, for the partnership with Spectrum Health and for your willingness to volunteer your time to bring this important information to our members and the public. And welcome.
Thanks for having me. I'm happy to have this opportunity.
Great. So Jenna has a number of slides that she's going to go through and give you information. On the slides are some anachronisms. I can never say that word correctly. Jenna, how do you say that?
Acronyms?
Acronyms, thank you. And so if you're, luckily this is a recording, so if you're wanting to capture those more regularly, or, so that you can write them down and ask your doctor about them, you can just stop this recording and go back and see what she said and see the slide and write it down. If there's more information that you weren't able to capture, you can always just reach out to us and we'd be happy to share the PowerPoint with you so that you can have that information right at your fingertips. So with that, I'm going to stop talking and I'm going to let Jenna take over. And so if you'll just give us a second here, because I'm going to go off screen and then start sharing my PowerPoint. So. I just have to wait till this, there, it goes away. All right, I think we're all ready for you, Jenna.
Thank you. As Melissa mentioned, our topic today is multiple myeloma. The following slides were medically reviewed by Craig Cole, MD, in March 2020. A quick disclosure, this program was developed by Cancer Support Community. We developed the content independently and then had outside medical and psychosocial experts review it. CSC has final control over the content of our programs. This program was generously sponsored by Sanofi Genzyme and GSK. The presenter was engaged by your local cancer support community, Gilda's Club. I, Jenna Curtis, have no financial relationships or affiliations to disclose and am not being paid by Sanofi Genzyme or GSK. Our discussion today will include what is multiple myeloma, causes and symptoms, tests for diagnosis and monitoring over time, treatment options, finding a great healthcare team for you, and coping with multiple myeloma. We'll also give you the opportunity for questions and we can provide answers with time, and we ask that you complete an evaluation at the end. What is multiple myeloma? Multiple myeloma is a blood cancer that starts in the plasma cells of the bone marrow. This is the spongy center of bones. This is where stem cells or immature cells mature into red blood cells, white blood cells, and platelets. Myeloma cells are abnormal plasma cells that make an abnormal antibody called the M protein. Plasma cells develop from B lymphocytes or B cells. This is a type of white blood cell. Plasma cells make antibodies to fight viruses and bacteria. Myeloma is not to be confused with a bone cancer or a skin cancer. It's a type of blood cancer. Problems caused by multiple myeloma. When too many of those abnormal plasma cells with too many M proteins crowd out healthy bone marrow cells, it leads to tumors, problems with the immune system, and CRAB symptoms. CRAB is an acronym for the most common symptoms of multiple myeloma. C, high calcium in the blood or hypercalcemia. Symptoms include dry mouth, nausea, vomiting, anorexia, constipation, excess urination or thirst, fatigue, depression, or confusion. R, renal or kidney damage, also referred to as the myeloma kidney. Broadly speaking, multiple myeloma can alter the filter pipes and the tissue of the kidney. A, anemia or low red blood cell count. Symptoms may include fatigue, shortness of breath, or weakness. This is often diagnosed with lab work. And B, bone pain and fractures. Symptoms depend on how extensive your disease and your body's response. Not everyone has these problems. Cancer generally occurs when cells don't grow and die normally. Multiple myeloma may begin with genetic mutations in the plasma cells. Again, these cells in the bone marrow help fight infection. The plasma membrane protects the cell from its surrounding environment. These mutations in the plasma cells are acquired as people get older from environmental exposures, such as radiation or pesticides or something else. The exact cause may also be unclear. People at risk for multiple myeloma. About 1 in 132 people are diagnosed each year. Multiple myeloma is the second most common blood cancer diagnosed. Your risk of myeloma increases if you are older than age 60, African American, closely related to someone with multiple myeloma, a man versus a woman, very overweight or obese, or diagnosed with other plasma cell diseases. This includes MGUS or monoclonal gammopathy of undetermined significance. This is considered a precursor. 1 in 100 people with MGUS develop multiple myeloma. More about those CRAB symptoms. Low blood counts may lead to anemia and infection. Anemia is present in 60% at diagnosis. Symptoms may include weakness, fatigue, or infection. Infection is a risk secondary to the low levels of iron, which is a natural immunity defense. Decreased kidney function occurs in over half of myeloma patients. Symptoms include weakness, and you may have elevated creatinine with blood work. Bone damage affects 85% of patients and leads to fractures. Symptoms may include bone pain or obvious fractures. And bone turnover. This is what leads to the high levels of calcium in the blood or hypercalcemia. Those symptoms include loss of appetite and weight loss. About 10 to 20% of patients with newly diagnosed myeloma will not have any symptoms at all. Diagnostic and monitoring tests. Tests are used to diagnose multiple myeloma, then monitor it over time. A physical exam and health history may include environmental exposures and family history. General blood tests may include a complete blood count. With the overcrowding of myeloma cells in the bone marrow, some blood counts may be low. Specific myeloma tests, such as the beta-2 microglobulin. This is a protein made by myeloma cells and may indicate how advanced the disease is. You may also have chemistry tests used at diagnosis. Urine tests, or a 24-hour urine test, measures the number of myeloma proteins in your urine. Bone scans, or bone density test, looks for areas of abnormal bone growth and fractures. A bone marrow biopsy would show the percentage of normal and cancerous plasma cells. It confirms diagnosis with the presence of multiple myeloma cells. And biomarker tests, or genetic testing or molecular testing. Cancer occurs because of abnormal changes in the human genome. Here we can look more at some of the labs that you might commonly see. A CBC, or complete blood count, counts the number of red blood cells, white blood cells, and platelets. A CMP, or complete metabolic panel, measures levels of albumin, calcium, and creatinine to assess kidney and liver functions, bone status, and the extent of the disease. The beta-2 microglobulin determines the level of a protein linked to multiple myeloma and kidney function. This is used for staging. It's considered a tumor marker test. The B2M is released by or in response to cancer cells. LDH determines the level of multiple myeloma cell production and the extent of multiple myeloma. This is also used for staging. Elevated LDH indicates tissue damage. Serum protein electrophoresis detects the presence and level of M protein. This tells us how much myeloma. Immunofixation identifies the type of abnormal antibody proteins such as IgG, IgA, and IgM. These are immune globulins that protect the body against illness and infection. Serum-free light chain measures myeloma-free light chains, kappa and lambda, in the blood. This also tells us how much myeloma. These levels may be elevated in the blood and can be used to detect, diagnose, or monitor. Urine protein electrophoresis detects Bence-Jones proteins, otherwise known as myeloma light chains, in urine to determine if it's present or not present. And the 24-hour urine analysis is collected to test the presence and levels of the Bence-Jones proteins in your urine. This also tells you how much myeloma. Diagnosing myeloma. MGUS, or monoclonal gammopathy of undetermined significance, is a non-cancerous condition with abnormal M proteins. The bone marrow biopsy would show less than 10% plasma cells, and you would have no other signs or symptoms of myeloma, referring back to that CRAB criteria. Monitoring is recommended. There's a 1% risk of progression within a year to multiple myeloma or related conditions, such as amyloidosis. Smoldering or asymptomatic myeloma, blood tests would show M proteins are high, and the bone marrow biopsy would show greater than 10% plasma cells. But there would still be no other signs or symptoms of myeloma and none of that CRAB criteria. Active surveillance would still be recommended. Plasmacytoma, or solitary plasmacytoma, is a tumor consisting of abnormal plasma cells that grows within the soft tissue or bony skeleton. This means that only one mass of abnormal myeloma cells are seen rather than multiple masses, and treatment depends on symptoms. You may also see plasmacytomas present in conjunction with multiple myeloma. In symptomatic or active multiple myeloma, the M proteins are high, and there is at least one myeloma CRAB symptom, and bone marrow biopsy has greater than 10% plasma cells. You may not feel sick, but your multiple myeloma may still be symptomatic, and treatment is recommended. This is another diagram comparing the different types of myeloma, the MGUS versus the smoldering myeloma and multiple myeloma. Biomarker tests in the myeloma cell's DNA can direct treatment decisions. So starting with that mutant cell corrupted DNA, the myeloma cell, your physician may look at chromosome abnormalities and do conventional cytogenic analysis or karyotyping, looking for large mutations. And then they may also look at the DNA. FISH is the most commonly used test, and it's looking for specific mutations in myeloma. There also will be very detailed testing looking at DNA mutations, such as genetic expression profiling and whole genome sequencing. These are the various stages of multiple myeloma. Stage 1, the beta-2 microglobulin will be less than 3.6 milligrams per liter with a normal LDH and none of those high-risk cytogenetics. LDH is an enzyme required during the process of turning sugar into energy for your cells. LDH is released into the bloodstream in response to tissue damage or injury. Elevated levels may indicate disease such as cancer or injury. For stage 2, the beta-2 microglobulin would be between 3.5 and 5.4 5.4 and would also have no high-risk cytogenetics. In stage 3, the beta-2 microglobulin would be over 5.5 with a high LDH and or high-risk cytogenetics on that FISH test. Some of those high-risk cytogenetics may include a deletion in the 17th chromosome, translocation between the 4th and the 14th, translocation of the 14th and 16th, or translocation of the 14th and 20th. Now we'll kind of talk about treatment of multiple myeloma. Unfortunately, until a cure is found, multiple myeloma is treated like a chronic illness. It is managed on and off over time. Treatment planning is the process of thinking about the treatment steps you can take with your doctor based on your own personal goals and preferences. Treatment decisions are based on the results of your biomarker tests, FISH tests, and the stage of multiple myeloma, your own personal values, goals, and preferences, your age, your health and symptoms, and your medical history and past treatments for multiple myeloma. Choosing a treatment plan revolves around various things such as clinical trials, age, comorbid conditions, myeloma symptoms, geography, risk profile, access, and lifestyle goals of therapy. All of those things revolve around patient preference, and your treatment is individualized. Treatment approaches vary based on the disease. For MGUS, we choose the monitoring wait and watch. They may recommend lifestyle and diet recommendations. This might include low red meat intake and increased fish intake. For smoldering multiple myeloma, we do close monitoring or observation. If you're high risk, you may discuss drugs and risks and benefits with your provider. And for active myeloma, for initial therapy, they would do induction therapy for myeloma, followed by high-dose chemotherapy and stem cell transplantation if recommended by your attending physician, maintenance therapy, and then followed by therapies for relapse myeloma at the time of relapse. Any of these can be used in conjunction with bone strengtheners such as bisphosphonates and other supportive treatments. At any point during your diagnosis, clinical trials may be an option. Treatment of MGUS or smoldering multiple myeloma. Active surveillance is a schedule of regular tests to monitor the cancer and address changes. Blood and other tests may be done every 6 months or annually. Healthy diet and exercise habits can slow progression. You would focus on eating more plant-based foods and less processed foods. Try to exercise. Walking is a great form of exercise for at least 30 minutes a day. Relaxation strategies such as deep breathing, yoga, or listening to music can help you cope with your stress and anxiety. Talk with a professional counselor if you feel too anxious or too stressed. And it's important to focus on what gives you pleasure now instead of worrying about the future. Treating symptomatic or active myeloma will vary. Different drug treatments may be used in combination at different times. Immunomodulatory drugs help the immune system find and attack multiple myeloma cells. Proteasome inhibitors cause cell death in multiple myeloma cells. Monoclonal antibodies attach to proteins on cancer cells to help your own immune system find and kill those cancer cells. Chemotherapy kills fast-growing cancer cells, but also fast-growing healthy cells. This is why we see hair loss. And steroids in high doses can trigger the death of multiple myeloma cells, decrease side effects, and treat inflammation. Your provider might also recommend stem cell transplant, which can lead to long-term remission. We most commonly see autologous transplants, but you may also see allogeneic or bloodless. Transplants are done with myeloablative chemotherapy, followed by stem cell transfusion. Preparation and recovery takes time. It may take weeks to set up your stem cell transplant, and you may spend weeks in the hospital. Supportive care drugs, radiation and surgery help to treat bone tumors and repair fractures. Bone strengtheners to help heal the lytic lesions in myeloma. Complementary therapies for pain reduction like acupuncture, relaxation, hot or cold therapy. Treatments to manage your symptoms like anemia or kidney problems. And here we'll look at a standard drug overview. These are the tools of trade for frontline therapy. The immune modulatory drugs include Revlimid or lenalidomide and Thalamid or Thalamide. These are both given orally. Proteasome inhibitors include Velcade or bortezomib, Kyprolis or carfilzomib, and Ninlaro. Velcade and Kyprolis are both given intravenous or by sub-Q injection, and Ninlaro is given orally. Chemotherapy may include Cytoxan or cyclophosphamide, Elcrin or Melphalan. These are both given orally or intravenously. Steroids may include Decadron or prednisone. These can both be given orally or intravenously as well. And monoclonal antibodies may include Daratumumab or Darzalex, which is given intravenously. This is the National Comprehensive Cancer Network recommendations for treatment. Frontline treatment would be induction. This is the first series of therapeutic measures to treat a diagnosis. Consolidation or post-remission therapy is used to kill any remaining cancer cells and sustain remission. And maintenance therapy would be to keep your body in remission. And then relapsed or rescue or salvage therapy would be given after all other options are exhausted. At any point in this phase, you may consider clinical trials. Treatments offered will depend on disease-related symptoms, biomarker test results, the risk of another relapse, your general health, past treatments and how well they worked, side effects from previous therapies, and available clinical trials. Drug treatments, different combinations are used at different times. These are the same options as those available for active myeloma plus other new agents. And again, clinical trials can be an option. Supportive care drugs and palliative care to treat pain and discomfort, complementary therapies for pain reduction, again, the acupuncture, relaxation, hot and cold therapy, and treatment to manage other symptoms. This kind of looks at different treatment options for relapsed myeloma. There's options for first relapse on Revlimid maintenance, first relapse on Velcade maintenance, and first relapse off treatment or maintenance. And again, you can always consider clinical trials. In addition, there's various options for second or later relapsed, and then late relapsed, aggressive, or relapsed or refractory multiple myeloma. At this point, they would maybe consider allogeneic stem cell transplant when you receive stem cells from another healthy individual, or clinical trials. Clinical trials can be an option at any stage of multiple myeloma. Many exciting developments are happening to test new models of care, versions of existing multiple myeloma type drugs, drug combinations, tests to track multiple myeloma, and classes of therapy. Bone support and control of bone pain. To manage pain and control related problems, there are several bone strengtheners and supports. Strengthening drugs include biphosphonates or monoclonal antibodies. You can ask your physician how to manage these side effects. Biphosphonates may cause bone or muscle pain, and monoclonal antibodies may cause allergic reactions or flu-like symptoms. Vitamin D and calcium supplements to help bone healing. Orthopedic supports such as physical therapy, splints, or surgery. Drugs to control pain. Radiation to reduce bone pressure. And anticonvulsants or antidepressants for nerve damage and numbness. An anticonvulsant might be gabapentin or Neurontin, and antidepressants include venlafaxine or Effexor, bupropion or Wellbutrin, duloxetine or Cymbalta. Now we'll kind of transition and discuss your healthcare team. Choosing your healthcare team is important to find a good fit for you. Ideally, you can work with a hematologic oncologist who's experienced in treating multiple myeloma. Ask if they're up to date on the many new treatments and clinical trials available, and look for care at the NCI designated cancer center. Ideally, you can talk openly with your healthcare team and trust their advice. Building a rapport is important. Ideally, you can feel respected and listened to by your doctor, nurse, physical therapist, social worker, and other members of your team. You can always seek a second opinion from a different hematologic oncologist to be sure that you're receiving care that fits your needs. This is a respected step. You have the right to get a second opinion. Some insurance companies may actually require second opinions. A second opinion can help you confirm your diagnosis, give you more information about options, talk to other experts, introduce you to clinical trials, and help you learn which healthcare team you'd like to work with in which facility. This will help you decide a best fit for you and your family. Palliative care services are very important within cancer. This is also known as supportive care or symptom management. It's not to be confused with hospice. Palliative care provides patients with relief from symptoms, pain, and stress, whatever the diagnosis. It is provided by a team of healthcare professionals who work together with the treating team to provide an extra layer of support. It is appropriate at any age and at any point in your disease. Palliative care can also help with the emotional impacts of having a chronic condition, and treatment changes over time. Open communication is key. Be your own advocate. Tell your healthcare team about your symptoms and how they impact your life, any treatment side effects you feel and how those impact your life, your questions, if you use vitamin or herbs, alternative treatments, since these could affect your treatment, if you use any over-the-counter or prescribed drugs, and your goals for treatment, as those may change over time. Ask questions. What treatment should I start with and why? What are the side effects for my treatment? For how long and how can I manage them? How will we monitor my myeloma? What will treatment cost? When should I switch from one treatment to another? Is there a clinical trial that I should consider? Will I ever be able to take a break from treatment? What should my family and friends expect? What else can I do to stay as healthy as possible? Can you suggest any dietary changes I can make? And what other resources or support groups are available to me? Before you choose your treatment path, you should know your multiple myeloma diagnosis, risk, stage, and how to read your M protein level, your care team and how to get in touch with them, side effects you should expect from each treatment so that you can report problems and get relief, where to get a second or even third opinion, your past response to treatment if relevant, and about clinical trials available to you at any point in your stage of disease. Transitioning into coping with multiple myeloma. Doing things that can help you feel stronger and help you cope, such as eat better, drink healthy fluids such as water, and exercise daily with medical approval to keep your body stronger, help your kidneys and give you energy. Avoid infection and illness as much as possible because multiple myeloma can weaken your immune system, making you susceptible to infection. Avoid heavy lifting and be careful with strenuous exercise to protect frail bones. Seek help if you feel scared, depressed, or anxious. Cancer in general may affect your mental health. Take advantage of cancer support resources to help you and people who care for you. There are no known ways to prevent MGUS or multiple myeloma, and there are no symptoms at earlier stages. The goal of treatment is to live for as long as possible with the best quality of life. It's best to work with an experienced team of providers who you trust. Be open and honest when you talk with your nurse or doctor so that they can give you good advice and help you manage your disease. This is an exciting time for clinical trials and multiple myeloma treatment. Stay aware of new treatment options and ask your doctor if there's a clinical trial that may help you. People can learn to cope with this diagnosis for a long time by being empowered to gain control, knowledge, and support. Now we'll give an opportunity for questions and provide answers. And then we have various resources available to you that will be presented on the slides.
Can you see them, Jenna?
Yeah, I can.
Okay, good. All right. So here we have the Cancer Support Helpline. and a place of open to options where you can talk with helpline specialists and Gilda's Club staff to help create questions and your list of questions. And then cancer support communities have lots and lots of resources right on their website. And so we encourage everybody to just take a minute to look through those resources and see if there's anything that can help you. And Jenna, I think probably your office, is there an office that if people have questions or maybe are seeking that second opinion, that they can get a hold of you or your clinic that you're in?
Generally, our patients come from the Cancer and Hematology Center.
Okay.
My role is a little bit more advanced for when they're seeking stem cell transplantation as part of their treatment plan. So those questions would probably be directed more towards the CHC office, which they have an office at Lemon Holton Cancer Pavilion at Spectrum Health.
Great. So they could just call the Lemon Holton Cancer Pavilion and they would help direct them to who to talk with. Oh, that's wonderful. And I do know here in Grand Rapids, we also have a great resource, a consortium of clinical trials that they can get a hold of to talk about the options that are available to here in West Michigan and in the greater Michigan, state of Michigan. So lots of resources to tap into. Yeah, so I'm going to stop sharing my slides here for a second. Okay, great. Did that? All right. So, what great information, Jenna. Thank you very much. This seems like a very complicated and cancer. Like there's lots of moving parts, lots of things to consider, different levels. And I think that you did a great job of just succinctly laying that out. Yeah.
Thanks.
Yeah. So, and again, if any of you have questions about that, you can always just rewind this particular evaluation or excuse me, this particular recording and look at those again and then get a hold of us at Gilda's Club. We also have a bi-monthly on Monday evenings multiple myeloma group that meets. And if you are interested in joining that group, we would love to have you. It's a free support group for people that are diagnosed with multiple myeloma. And I believe also their support person. You can give us a call at Gilda's Club 453-8300, and we can help you get connected to that group. So I think that's, one other thing that we have, there is an evaluation for this particular program, just a little review. We ask if you're willing to please look at that posting right under this recording and to take that quick 5-minute evaluation. It really helps us to know that what was in the slides is really helpful to you, or if there's something else that you would like to learn about also. So we thank you for doing that. And if you have issues with that, again, just get a hold of us. So again, Jenna, thank you for coming on and sharing your expertise with us about this, this diagnosis and this cancer. So grateful to you for all of your work in our community and caring for our members who have this diagnosis. And yeah, what a gentle and kind, nurturing thing to do of helping people through that process of their bone marrow transplant. I know that that can be quite difficult. And so thank you for all of your work in that.
Thank you very much. And thank you for including me.
Yeah. Again, if you have any questions, get a hold of us. We'd love to hear from you. Gilda's Club, gr.org, 453-8300. Take care, everyone. Thanks so much.